I'm going to go ahead and introduce our exiting president, Jane Burns, and she is going to just share some words from the region, and then we'll continue with our closing program.
Thanks, Charlie. Thanks, everybody who has been joining us for the week. It's been an awesome, awesome experience. We never knew what it was going to be like 2 years ago when we thought we were going to Anaheim, California, and we were kind of in Anaheim, California, but virtually. And it has just really been a pleasure. I hope you all have really enjoyed it. This is my last meeting as president, and then we get to welcome Doug Watson as our incoming president for the next 2 years. And we get to see some fun stuff happening with that. I want to take a moment and thank Charlie and Jessica, our meeting chair and assistant chair. They have just been outstanding. Their planning team has been outstanding. It's really been a wonderful process and a wonderful experience. And this is the last presentation, which will be fabulous, I know, as well. So I'd like to take a minute and welcome Doug as the new president. Doug, anything you want to say to everybody?
I just want to say I'm excited. And Charlie, you did an outstanding job. You and Jessica and your crowd did amazing, amazing work. I'm really excited to see what we have in Anaheim. I'm actually excited to see what Jane and the national gang have for us in Colorado coming soon. So there's a lot of things coming up. Please, if anybody has questions, problems, issues, you want to help out, we want to help. And I have a few things we need to set up. So please email me, dwatson@uvu.edu is how you get with me. Easiest way anyway. And I would love to work with you. Thanks.
Thanks, Doug. And thanks for the plug on the national. I want to remind everybody, this was our regional year for all 4 regions, and the even years we get to be together. So our goal is to have an in-person meeting. I hope we get to see you all in person next year. We will have a business meeting there that hopefully is in person and will be more fun. So again, Charlie and Jessica, thank you so much. You guys just did a fantastic job.
Thank you. And to our planning committee, please check out your program just to reflect on our planning committee. They did so much work to make this happen, and we could not have done it without them. So thank you to all of you who served in every possible role to make this successful.
Okay, so on to our speaker.
That's my cue. Thank you all so much. Welcome, everyone. My name is Selva Munoz, and I'm the Assistant Director for Post-Bac Programs at Keck Graduate Institute. I have the greatest honor to share with you some things about one of my mentors, and I can share things that you cannot find in his bio. He's very approachable. He's humble, giving, and respectful. He embodies all of the characteristics that we share with our students that healthcare providers are. He is also a Star Wars fan. His favorite baseball team is the Los Angeles Dodgers. He's the father of 2 children and the husband to Dr. Cheryl Brown, who is super amazing. My absolute favorite thing to share with you all is that he is inspirational and he's an excellent mentor to many people, including myself. He is Dr. Efrain Talamantes. He is the Chief Operating Officer of Health Services at AltaMed Health Services Corporation in California. He is also a primary care, internal medicine physician. In his many roles, he touches nearly every aspect of day-to-day care and helps shape the ultimate experience across the entire healthcare delivery system. Dr. T, as many call him, has been instrumental in optimizing the way AltaMed cares for its patients in the midst of the COVID-19 pandemic. You might have seen him in the news educating the public on important public health measures. He is one of the co-founders for mimentor.org and leads initiatives throughout the country to enhance leadership and diversity in the healthcare workforce. And I invite you all to read his entire bio in our program. It is my absolute honor to introduce our keynote speaker for the Western Association of Advisors for the Health Professions, Dr. Efrain Talamantes. Thank you for for being here with us. I'm so grateful to work alongside this great journey of mentorship with you. And thank you for your incredible service to our communities.
Oh, thanks so much, Elba, for the beautiful introduction. And thank you all for the invitation. It's really an honor to be with you all. I know we're on the home stretch here. And yes, go Dodgers, but hey, you never know how things can turn out. There's a lot of great teams this year, and it's really exciting to see folks coming back to the ball games and enjoying their families and the games together. So hopefully you'll have a chance. And if you're not a baseball fan, there's always basketball, and if not basketball, there's always Star Wars. So thank you for that. I just want to share a few thoughts with all of you. Primarily, what motivates me to speak to all of you is that I am a product of many of your efforts and energies and sacrifices. I know that many of you, advising is not for the lighthearted, especially in the health professions, given the numerous obstacles that our learners face in not only accessing good information, but really having a fair shot at realizing their dreams of becoming health professionals. And today I serve as the Chief Operating Officer here at AltaMed Health Services. We're a large community health center here in Southern California. We serve about 300,000 patients. And just to give you a sense of the magnitude of our reach, just during this pandemic in the past year and a half, we've tested over 100,000 individuals for COVID-19. And during the worst of the pandemic here in Southern California, almost 40% of those tests were coming back positive. So you can think about the thousands of tests we were testing on a weekly basis and how many were coming back positive. And unfortunately, even I still get to practice in my clinic. I have a lot of my patients. I practice in Boyle Heights, which is one of the most underserved areas in the country when it comes to health. Many of my patients not only lost loved ones, their partners, but mothers, fathers, grandparents, you name it, uncles and aunts. And so it's really a devastating time. Through all that, it's also impressed upon me that your advice may seem that it's only helping someone pass a course or take the next course, or maybe pivot from one focus to another. But ultimately, that all those experiences are really are going to be a culmination, and a culmination of growth opportunities, so that when they're delivering care at the point of care and they have a patient in front of them, like I had many, that they're going to bring everything they've learned, not only from the classroom, but everything you advise them on how to, think about or reframe a struggle, how to reframe a failure, how to overcome and think about using opportunities of struggle to grow and stretch themselves. And those are the kinds of moments I reflect on, with a lot of intent when I struggle, especially when my patients are sharing with me that they're having a real tough time. So I'm going to do a couple of things. I'm going to go ahead and share my screen here, just to give you a sense of where I'm coming from, and really emphasize a few key points regarding the way that me as a Chief Operating Officer, as a primary care physician, but more importantly as someone who continues to be very concerned about our safety net. Many of the areas throughout the country, not just here in Southern California, that continue to be underserved in terms of health professions. So again, just to give you a good sense, AltaMed, we're a federally qualified health center. We're designated by the Human Resource Service Administration as a federally qualified health center. That means that most of our clinics are in some of the most underserved areas in the country. When you think about the Centers for Disease Control Vulnerability Index, we have individuals that we serve that are in the highest quartile of vulnerability. Almost 80% of our patients are in the top 2 quartiles of vulnerability. What does that mean? That means that they live in homes that are crowded or crowded housing conditions, what we call home. They're also in areas where you have food insecurity, food deserts. You have areas where there's high levels of poverty. There's high levels of linguistic isolation, meaning that not everyone speaks English or communicates with English as their primary language. And of course, we have people from all walks of life that come to our center, and we don't worry about whether you're insured or not insured. We figure out a way to get the primary care you need, even get you specialty care if needed, and get you into healthcare to make sure that we take care of you. So many of us are very familiar with these depictions of equality versus equity. Equality, everyone gets the same. Equity, everyone gets a custom sort of effort, in this case, a bike that is custom made so that it makes sense, right? You don't want to have a big bike if you're a small person versus a small bike if you're a big person. And so there's this concept of going above and beyond to really custom tailor what we need to do to ensure that you can still have a joyful ride. These depictions take a whole new meaning during this pandemic. And I know that many of us and many of you also had to overcome and had many challenges for a variety of reasons due to the pandemic. And many of you may have also lost loved ones. And so interfaced with the healthcare system. And we know that the healthcare system in the US needs a lot of work. It's not perfect by any means. Even if you do have the means of accessing care, you may not actually have a great experience, even if you do have access and can afford it. We also know that our concept of equality, equity, and justice has evolved and continues to evolve. What we know today, the way we understand these issues is very different than we understood them a month ago, maybe a year ago, maybe a couple of years ago now, given the dramatic events that we saw, plain sight, whether in our communities or through the media sharing these tragic stories of social injustice. And so really moving from giving everyone the same to customizing to really understanding that there are true barriers that we need to remove in order for folks to have a real opportunity to enjoy an optimal, whether it's optimal health in this case, or watch a soccer game. So there's some soccer fans out there. But really that this is an opinion piece that was recently published in Medicine Psychiatry and by Dr. Barcelo, who's actually one of my mentees, but really challenges the notion of equality, equity, and justice based on a biological phenotype, really that when you think about the depictions I shared before, they're based on people's size. And we know that that's biologic. We know that, how tall you are oftentimes will depend on your genetics and your family. Well, when we start talking about race, ethnicity, and a lot of these other factors as it relates to opportunities to reach optimal health or have even opportunities within the health professions, we know that race is not necessarily something biologic that is predisposing someone to limited opportunities. If anything, that what we understand today is that race and sometimes ethnicity can also be used socially to limit ourselves or have others limit us in terms of our potential. And we could see here from the depiction that you can have the same race, whatever that may be in terms of how you identify, but depending on the circumstances that you're in, you may not ever have a shot to really be able to enjoy the view over the fence. And so here you have an individual who's so far down a ditch that it's very hard for them to even think about how they're going to be able to pull themselves out, while someone else maybe in a systemic may have factors, right, ball and chain in this case, who's really weighing them down. And no matter what, it's almost impossible to think of a scenario where they can relieve themselves of that ball and chain. And then there's individuals that may have, no matter how challenging, such an advantage that they're going to do incredibly well, and see and have the opportunity, have so many more opportunities than their counterparts. So as we begin to really conceptualize advancing health equity, advancing equity within the health professions, it's really about removing obstacles. And oftentimes these obstacles may not be as clear to us because of our own upbringing or where we come from, or better yet, we haven't necessarily encountered some of these challenges in a consequential way. So whether it's poverty, discrimination, and all the consequences that come with that. So powerlessness, feeling shamed, what we call imposter syndrome, what we also label as stigma. These are the kinds of things that are included in that category of powerlessness. And we see it all the time. We see it in students that we encounter, the way that they talk about themselves, the way that they share stories about themselves. We could tell that there's something that they've accepted, and or there is someone's perpetuating. Even they've had bad experiences with prior advisors, where they come to you with a sense of powerlessness. And it does take a lot of work for us to help them to overcome that, because it is a journey. It's not something you turn off and on. And it's years of trauma. I think as a mentor, no matter how successful I am, even if I tell people that they could do it, I'm trying to undo 25 years, sometimes 30 years of harm in terms of them feeling powerlessness, where they grew up, the opportunity or lack of opportunity to have, lack of access to just positive thinking, right? Really thinking highly of themselves, or thinking that they have something to give back to the profession. And more importantly, that there's a lot of missed opportunities in these communities. And we saw that clearly play out. As a community health center, we were the first out there to take care of people with COVID, given how many were coming down with COVID. And in our own health system, we have about 300 physicians and about several thousand nurses and other allied health professionals. We didn't have personal protective equipment. As a community health center designated by the government, we struggled not having enough equipment to protect ourselves. We struggled to have access to testing, given how many tests we had to complete. And that really took a stance of not just advocating for ourselves, but it also took a stance of here's a clear example of an inequity that even as a physician within the safety net, I'm being left behind. We're being left behind. And really that there's a lot more need than maybe say down the block somewhere else where they had access to COVID, but they weren't offering it to people without insurance or people that are underinsured. And so these are real examples real time of the inequities that are the obstacles that we have to continue to focus on and remove. So this is a picture of an LA Times article, if you had a chance to read it, given the enormous amount of people who had lost loved ones in East Los Angeles, where I practice, and the enormity of the consequences of losing loved ones during the pandemic, right? I had patients coming to me telling me that they weren't able to bury their loved ones because there wasn't any place that would help them morgue, prepare their loved ones' bodies for burial or any other type of burial process. We also saw that it was multi-generational families. So when we talk about crowded housing, it was entire families early on, having patients come to me and having symptoms, and for us to say, well, here's the CDC, guidance that says that you have to go isolate at home and stay in your own room. It was almost like we were, giving them nonsense advice, right? Knowing that it's almost offensive that we were telling them to isolate in the room when we know firsthand that many of our patients don't have the luxury of having their own room, let alone, even a corner space in a home or in an apartment complex, right? So these were the kinds of experiences that really, for us in our workforce, made it real in terms of understanding what our mission is about. And our mission is to eliminate disparities in health and health outcomes for these communities that were the hardest hit. And yet we had the least amount of resources, and we had to figure it out because it was either us or all these patients would have ended up in hospitals mainly, or other systems that weren't prepared to take care of them. This is a picture of one of the housing complexes that we actually serve. We're right next door to this. We actually have a facility within this housing complex at AltaMed, but we also have a clinic down the street, our Boyle Heights clinic. So this is the Strata Courts. This was a building that came up during the right after World War II, to be able to house individuals. And, it was really an attempt to ensure that there was affordable housing. And it really attracted a multitude of different families from all sorts of walks of life. Obviously, over time, it's become predominantly Latino, but really that one of my patients during the pandemic came to me, and she lives here, and I actually had a chance to visit because this was a patient that I've been taking care of for years, 2 years, almost 3 years now, since I came to AltaMed. And her initial challenge was difficult to control blood pressure. And, she shared with me that I was the first doctor that she had ever been cared by who spoke Spanish, that every other physician, didn't speak the language. And that wasn't as much of a challenge for her. But what she felt was oftentimes she wasn't listened to. No one was listening to her story, where she came from, what were her, what was beyond the hypertension, the clinical stuff. And we controlled her blood pressure. She continued to see me, and during the pandemic, we screened her for breast cancer. That came back positive. So she had advanced breast cancer, had to get her into treatment. And this is all through the pandemic. So they're getting tested, her and her family. Some are coming back positive. She's losing family members to COVID. On top of that, she's got a cancer diagnosis, and she's got to start chemotherapy. And most recently, as we started to vaccinate, she had her surgery. And she's doing really well. She came to our clinic a couple of weeks ago, and my nurse shared with me that she was so happy. She was skipping up to the clinic. And this is not a demeanor that she's had for a long time, for at least 1.5 years, given the challenges she's faced with breast cancer. So not only doing well, but she calls me right after her surgery and says, "Should I get the vaccine?" I said, "Of course." She said, "Well, what about, I just have all this inflammation, and we went back through and said, well, think about all the loved ones you've lost or people you've lost in these housing complexes, because a lot of people passed away in these communities." And I said, the vaccines are only shot. Not only were we successful in getting you through an advanced breast cancer, but I would hate to lose you to COVID. So she got her vaccine. Of course, it hurt, and she was feeling a little uneasy, but overall did really well. But again, it just goes to show that not only was it important to know her story, but to really understand what she had gone through in order to be able to convince her otherwise that the vaccine was okay for her. And of course, she had a lot of reasons why not to get it, right? Because of inflammation already, because of the cancer, overcoming the cancer, removal, surgeries alone can cause clots. There was a lot of questions that came up. But she made the right decision and is doing well. Now, why do I bring this up? Well, during this pandemic, we saw social justice movements that were incredibly powerful and composed of many of us. I know many of you were part of them. This is a mural in Estrada Courts, and it's called the Moratorium. This is around the 1960s during the Chicano civil rights movement here in Los Angeles. And if you look at some of the pictures, it depicts police officers spraying, hitting, killing, actually, people of color in these communities who were protesting against the Vietnam War. They were protesting limited job, educational, and health opportunities. And it just gives you a good sense that our communities have not only been victims of systemic violence, whether it's law enforcement or others who come into these communities and cause violence, and these types of inequities are what ultimately results in a lot of the unnecessary deaths that we see today. And so as I started to talk to my patient and learn more about her history and learn more about the fact that, during her fight with cancer, she was very sad and down and depressed. And her oldest daughter is actually serving a life sentence because she joined a gang within the housing complex and was selling drugs and got in trouble. And that loss alone was causing a lot of loneliness and feeling like there's no one there to be able to carry on for her. And she's got younger, a son and another son, but there's nothing like her having her daughter. And so I had to, write numerous letters to where the correctional facility where she is, to give her an opportunity to FaceTime, just to be able to share some moments with her mom, given that she was going through cancer. And why I share this is that we know that these communities, many other communities where students come from that are seeking advice, it's not just that they're coming from poor communities. They're coming from communities that have, been impacted by so many different types of traumas. And there's so many challenges. And loneliness, just to bring it back to my patient, is felt so much more differently than loneliness if you have breast cancer and live in a whole different community and you have your whole entire family and whole social structure to support you. And so many times you'll hear about these issues in healthcare we're trying to tackle to help address loneliness and why it's important. But loneliness, when you think about the enormity of inequities that exist in some of these communities, there is a real challenge with addressing them. And it's not just about language. It's not just about understanding the culture. It's really trying to understand the individual for their totality and the beauty and the struggles and all the resilience that they bring with them. But not acknowledging that, for me as a doctor, I realized is a huge mistake, because I'll never get to control the blood pressure or diabetes. I have to be able to understand my patients holistically. I have to understand them from a multitude of dimensions. And yes, I want to get to, fill in what is it, the Scantron when you go and take the MCAT, right? The little bubble, right? You want to do, oh, this is easy. It's A, B, or C, or D, or maybe it's A and B combined or whatever, right? Well, life is not that simple for a lot of our patients, regardless of where they come from. And so many times, yes, we see students that really struggle with the MCAT, and they should continue to, and at some point, they will master it. But that's the easy part. The easy part is being able to fill in the right bubble and select the right medication in the case of hypertension or diabetes or even chemotherapy. The hard part is really being there and being present for the patient through these difficult times and really understanding who they are and what they bring to the table. And ensuring that we're not only empathic, but we really embrace that and embrace it in a way that is respectful. And you often hear, oh, well, I don't want to fill that form out, or I'm not going to write that letter for my patient because I don't have time. I don't get paid for that. But really that sometimes the most significant aspect of the work we get to do is write a letter to a judge to get a family member to be able to see their family who may be in a correctional facility. The beauty of all this is, there's a lot of different artists, community artists that have come back to Estrada Courts, and they're beautifying a lot of the different murals from, again, the 1960s or so when this was built. And many of these murals also depict the beauties in the places like this. Despite how challenging the conditions are, there's a lot of beauty, resilience, and there's a lot to share there. And so it's not just, again, thinking about equity as a way to think about the obstacles, but really that there's beauty in ensuring that we recognize that these patients have a lot to give and share. And I know that, my patient, for example, is a very prominent community member in her church. And so preserving her, getting her through not only breast cancer, but COVID has been a real blessing because the church really depends on her and how great all the stuff she does for her church and her peers. So that's another really nice story of being able to help others overcome, because they then get to take care of a community that otherwise I wouldn't be able to, given that I may not have the time or opportunity to serve that community. So I'm just gonna, really share a couple more thoughts here, and that is that, as we struggle in the health professions, and I remember going to many health advisors to think about my future and all the challenges I was having to overcome and all the deficits or a lot of the things I thought were deficits in my own life, given my own upbringing and the challenges I was facing, given where my family comes from. But really that at the end of the day, the closer we can get to the human side of our patients, not the science side, but the human side, the better. And really that should be and continues to be our North Star. I think that today, as we not only better understand inequities, but understand how this pandemic has brought us closer together, we've joined together to beat these pandemics, not just of viruses like COVID, but there's so many other pandemics, unnecessary violence in our communities, unjust hatred towards vulnerable groups, that we need to continue to encourage our young, aspiring healthcare professionals to stay as close to the human side of our patients. And that often, of course, has to be balanced, but oftentimes is what is least a driver of motivation. And so sometimes when I have students who are really struggling, I'll ask them, when's the last time you went to were with a patient, were able to take care of a patient? And sometimes, of course, it's difficult to get into the clinical setting. I get that. but patients are everywhere. There's a lot of different ways to care for patients beyond just in a hospital or clinic. And that's really where you'll find the stories as a learner that will continue to help you grow and stretch yourself, and really realize that whether it's a tough science course or the MCAT or applying or reapplying, that the struggles that we face are very different, oftentimes very tiny compared to the challenges that our patients are facing to overcome a multitude of not only challenges with disease, but a lot of social circumstances that have really put them in a situation where they need health professionals like us who not only want to get to, done with the 20-30 minute visit and give them a prescription, but that we have a duty to get to know them, understand them, and help them through those struggles, not only the disease struggles, but the life circumstances that they have. And of course, there's from that, there's a lot of, oftentimes our patients don't believe they have behavioral health need, that they're dealing with issues of depression, anxiety, or other. But over time, if you have that relationship, they open up and they say, let me give it a try. And really that is the North Star that guides us and will continue to guide us as we build a health profession workforce that is not only well-versed in understanding equity, but really will use equity as a lens to transform healthcare. And the beauty of it is we know, especially right now with all the vaccine work we have to do, about half our state here in California is vaccinated. We still have halfway to go. But really that our health is dependent on the health of others. And we always understood that before. In some of the research, if you read communities that where there's a lot more disparity between who's insured and who's not insured, where there's greater disparities, those communities overall tend to be less healthy, less health outcomes. They achieve less health outcomes. Those are also communities where there's a lot more safety issues, violence issues. There's other issues that arise in the social. So really that it's not just insurance to insure people. Oftentimes it's a way to make sure people have access to good healthcare so that everyone's healthy and that the social conditions improve so that everyone gets to benefit from those communities, going to the park, ensuring that everyone feels safe and has an opportunity to exercise and do all the things that we know are important to our health. So really, as you know, now as health professions, advisors, and thinking about your work and really using the pandemic and some of the struggles and experiences, but really thinking about how critical many of us who you've trained, who you've helped get to training, through pre-med, pre-health, is that, we were able to be there. I joke around with many of my colleagues that we must have skipped out or missed out on the medical school class that taught us about pandemics or how to be prepared or respond to a pandemic. But I'll tell you that many of the reasons when I was hitting my lowest point as a physician, as a leader at AltaMed, given everything I was seeing, going home and just knowing how bad things were in the communities that I serve, not having access and my kids not, being able to even go outside and do a lot of the things they enjoyed, was really that it was groups like this that I used to think about, because these were the groups that would come together and support us through dark times, right? To really understand and value, what is this dark time tell us about what we're looking for? What is the light? What is the direction we want to go in? And so that, just understand that, yes, as we emerge from this pandemic, and continue to fight it with encouraging more and more individuals to get vaccinated. And I'm sure the boosters will come. We'll have to get our booster to stay safe and all that. But just to make sure that you continue to encourage these young up-and-coming health professionals to use equity as a way to transform not only healthcare, but themselves and their communities. Because at the end of the day, that's what we need in healthcare. And we're starting to see it. We're starting to see a lot of disruption, given that the pandemic forced us to do things very different. We're doing telehealth now at mass scale. In 500,000 of our encounters are now moving to telehealth or telephone or video or a combination of both. So I think that is a good thing, is being closer to our patients, being able to provide care for them where they need it, how they need it, but also with the respect that they're asking for. And that is a fundamental, I would say, realization for me during this time, is that even though I study equity and I know equity from my own experiences, is that I continue to learn about equity, and I continue to learn about equity through the lens and eyes of my patients, because their experiences are so much more different than mine. And really embracing that as a way to continue to lead, to be an example, and to motivate others to not give up, because my patient, we'll call her Miss Hope, Miss Esperanza, really does need them to continue their training and succeed, because otherwise that's one less health professional in East LA that we can't afford to lose. And that's, the last thing I'll share is that going into this pandemic, we were in a health profession shortage area, and the pandemic didn't make it better, didn't resolve any of it. We are still in many, not just here in California, but throughout many states throughout the country. If you think about some of the rural areas, there's a real dearth of health professions, and we're opening up. I think that as physicians, historically we've been not open to physicians associates, right? Nurse practitioners, and we're starting to see those changes that were championed by many of us who were up and coming, who said, it doesn't make sense. We have to be more inclusive. There's so much more work there to do than there are us. We have to figure out a way to be equitable and to allow others to come into the profession to support primary care. And so with that, I would just end and thank you all for the opportunity to share a few thoughts with you and commend you on the great work you lead. And again, thank you for being that inspiration for me, and also giving me the opportunity to share some thoughts with you that I hope you can share with your colleagues and your students as well.
Fantastic. Thank you so much, Dr. Talamantes. Thank you for wrapping up our conference. This is very, your words. We had an opening keynote speaker on Tuesday, Dr. Tracy McNamara. I'm not sure if you know her. She's at Western University of Health Sciences. And she and our speaker yesterday, a pathologist from California, who is actually now in Wellington, New Zealand. And your words all really kind of tie our conference together in terms of just allowing us to go back to some of the critical needs that we have for our students, that we want to help support our students in pre-health advising. And so I just really appreciate your time and your message to us. Again, we're the Western Association. We have many members in Southern California. So a lot of what you spoke to is a lot of what we see every day. And I know our colleagues do around the country, but I know here in Southern California, and for many of us in inland Southern California, the experience that you shared is something that we see day in and day out in our institution of higher education, in our community schools, and in our neighborhoods and supermarkets. So thank you very much. To our members and attendees, thank you so much for sticking with us and wrapping up the end of our 4-day biennial conference. We are officially done. Our next meeting will be next year in June of 2022, hopefully in an incredibly different environment in terms of COVID-free, if a such thing exists, and we'll be with Jane, our outgoing president, and her planning committee in Denver, which we're super excited about that. And then we'll be back here in Southern California for our regional meeting of 2023 in June. So again, thank you everybody for attending. Have a fantastic and safe weekend. And we look forward to communicating with you in terms of our advisors. We will be sending out a survey, so please fill that out. Your comments will allow us to plan for future meetings. We'll also be sharing our YouTube channel where we have our videos and things that we've recorded this week. So we'll continue to have a little bit of WAAHP 2023 in the future. Again, thank you to Jessica, our assistant chair, who's been fantastic helping plan this, our planning committee, and our regional board, our current officers, our newly elected officers. Thank you to Jane, who's leaving, and Doug, who's coming in. And Jessica, is there anything else that you would like to share as we wrap up?
I think you did a great job. Let's all thank Charlie for leading us in the last 2 years. This was, he really led the way and was a phenomenal leader. So thank you, Charlie.
Of course. No, thank you. And thank you, everybody. This has been really awesome. Kudos to all of you for really planning 2 meetings, an in-person meeting that we pivoted to an online meeting. And I think it was a success. So thank you, everybody. Have a fantastic weekend. Be safe, and we'll talk soon.
Take care. Bye, everyone.